How does this proposed health care bill and the president's proposed budget impact women and health care?
Well, thank you, Pat, and thank you to Aspen for having me today, because we are poised, obviously, within potentially the next several days in Senate passing legislation that would have a dramatic impact on women. I think it's no surprise in some ways that women haven't been talked about, because as I think most of you know, women have been completely left out of drafting a bill that would impact all of us and our lives. And so just sort of a few high points. One is, that wasn't mentioned, is that this bill would prohibit folks on Medicaid, 1.6 million of whom come to us every year, from coming to Planned Parenthood for preventive health services. That means family planning, that means well woman visits, breast cancer screenings, cervical cancer screenings. For many women, we're their only doctor, and they would no longer be able to come to us for that care. As also wasn't mentioned that much is that this now makes it possible for states to repeal the requirements that we fought for so hard under the Affordable Care Act for essential health care benefits. Because one of the differences for women, or the primary difference for us, is that we do consume more health care because we reproduce. It's just how it happens. And so, of course, you know, everybody's got a mom, and so...
Including Dr. Price.
Yeah. So, I mean, some of the things that we fought for so hard there were making sure that all women could get their preventive health care covered with no copay, which would encourage more women to get preventive health services. One of the most hard-fought battles, ironically, back in the day was around maternity benefits, which were sort of glossed over, I think, in the last interview. The fact is, before the Affordable Care Act, maternity benefits were optional as a coverage point. And in fact, there was a big debate in Congress, in the Senate. I remember a senator from Arizona said, well, you know, they shouldn't have to cover maternity benefits because, as he said, I'm not going to need them. At which point, which seemed rather obvious. And then, but I'll never forget Senator Debbie Stabenow from Michigan came back and said, well, I bet your mother did. And so we did get maternity benefits covered, which is incredibly important. As you know, half of the births in this country are on Medicaid. But now that will become optional again. And the estimates are now that 13,000 women, 13 million women, excuse me, will lose access to maternity benefits. And in fact, if women now want to pay to get maternity coverage, the estimates is that it'll cost them between $1,000 and $1,600 a month just to make sure maternity benefits are covered. That's the kind of impact that is going to happen as a result of this bill, and it's not being talked about. We're not in the rooms, as they say, the room where it happens, and it's, you know, about to potentially pass without any input from women.